If you've had frequent dizziness or vertigo and your neck hurts, it may not be the crystals in your ear that keeps causing all the dizziness. It could be your neck. In that case, continuing to do Epley maneuver after Epley maneuver, not only will it not help, but it could even make your neck symptoms worse. Well, my name is Mauro Burnett, and I've been a physical therapist for 24 years, specializing in cervicogenic dizziness and cervicogenic headaches. Over my career, I've been able to help thousands of patients who suffer from cervical dizziness get over their symptoms and return to a better life. In today's video, I'm going to go over why getting the correct diagnosis between BPPV, or the crystal disorder, and cervicogenic dizziness is absolutely crucial. I'm going to go over a case example of one of my patients that I saw and explain how they got the wrong diagnosis and it made their situation a ton worse. If you would like even more exercises, more tips, more home programs to help with cervicogenic headaches or cervicogenic dizziness, don't miss my new book coming out December 1st of this year, Cervicogenic Dizziness Relief, A Complete Guide to a Dizzy-Free Life. I'll put the link below. All right, let's get back to the video. Also in the video, if you find that you do have cervical dizziness, I'm going to connect you to the right exercises that you can do so you can start getting some relief. Let me tell you about my patient, Sarah. Sarah was a patient that came to me recently who went to the doctor, got a routine examination. They found on an MRI signs that she had some disc problems in her neck. At this time, Sarah reported to me that she really didn't even have much neck pain. So the doctor recommended that she get some physical therapy for her neck. She went to the local physical therapist, and at this physical therapy office, the young physical therapist suggested that they should do chiropractic manipulations, these high velocity thrust techniques to her neck, that they were cross-trained in chiropractic manipulations, and that this would be very helpful for her. She thought, okay, you're the professional, whatever you think's best. So they started to do these maneuvers on her neck, and very quickly, within a few days, she started to get dizzy and vertigo, that 30-second severe spin. Sarah reported to me that she never got dizziness and vertigo prior to this. She went back to her physical therapist and reported to her therapist that she was starting to have these strange symptoms, and she was very concerned. The physical therapist retorted to her, you know what, I bet your crystals have come loose in your ear. This is a disorder that we call BPPV. We'll discuss that in a moment. And the therapist suggested there's a great maneuver called an Epley maneuver that will clear the crystals out of your ear. So I'm going to go ahead and do this Epley maneuver for you. Immediately after doing this Epley maneuver, the patient went home that day, and then they started to get another symptom. They're starting to get headaches. Never got headaches before. Now they're dizzy. Now she's getting headaches. She went back to the therapist, reported her symptoms again. The therapist suggests let's do another Epley maneuver, this time a slightly different Epley maneuver. So 1, 2, 3, 4, 5 Epley maneuvers later, now she's getting frequent headaches. She's still dizzy when she lays down or if she tilts forward too fast, and she's getting frustrated. She's talking to the therapist, she's talking to her doctor, and now the doctor is suggesting that maybe this is just an emotional reaction that she's going through. Through finding our clinic, through someone who knew someone, we were able to meet Sarah. After we met Sarah, we were able to hear her story, and we immediately changed up this whole situation. I said, let's stop all the Epley maneuvers. Let's stop all of the manipulations, and we're going to move into stability exercises. So why would having your neck in an Epley maneuver make her worse? That's a great question. When you're doing this Epley maneuver, and maybe you've had this done to you already if you've been diagnosed with BPPV. This is a disorder called benign paroxysmal positional vertigo. And the theory is that the crystals have come loose and they're now inside your semicircular canals of your ear. It's sending a false sense of movement, and that's what's causing your vertigo. There's a big bias among physical therapists and among some doctors that if you're dizzy, it's probably your crystals. When you do this maneuver, you tilt someone's head back about 45 degrees as you tilt them off the table, and then you rotate to the right, and then you hold that until the dizziness goes away, and then you rotate to the left, and then finally you sit someone back up. If you're having cervical instability, a condition where your upper neck has lost its deep core strength and the vertebrae are shearing already, having your head put back into this provocative extension and rotation position can really set off the neck and tick it off pretty good. In this scenario, that is exactly what was happening to Sarah. Having her head continuously manipulated wasn't making her better. In fact, it was making her worse. So when it comes to cervical dizziness, what you really need, besides the Epley maneuvers and besides the manipulations, is you need stability exercise. So I'm going to put up a link right over here over my shoulder that's going to connect you to a great video that I did on the exact stability exercises that you would need if you're having cervicogenic dizziness. Also, in my book that's coming out next month, Cervicogenic Dizziness Relief, I did a whole chapter on how to tell if you're having cervicogenic dizziness or BPPV, among other things. So let's go over a few of the telltale signs so that you can figure out what kind of vertigo you're having. So when it comes to differentiating cervical dizziness versus BPPV, or that classic crystals in the ear problem, there are a few telltale signs and symptoms that will help us differentiate. One, if you're having cervical dizziness, you will often also have cervical pain or neck pain. That's the number one most notable sign. If you wake up in the morning and you notice your neck's kind of cranky, it's tight if you turn all the way one direction or the other. Maybe it's tight if you go into extension or all the way into flexion, maybe even side bend. That is a classic sign that the cervical spine's not doing so well. If you have tenderness to palpation or touch at your upper neck, the top 2 or 3 joints, that's another sign that your neck is having problems in the upper part of your spine. If you have a loss of strength in your neck, here's what my patients will often tell me. They'll say, my head feels heavy from my neck. I feel like I just want to lay it back on something. It's hard to hold it up in a good posture. It just wants to flop back. A great way to do a test on your cervical strength is if you're lying on your back, on your pillow, you tuck your chin in and you begin to lift your head slightly off your pillow about that much. Is it shaky? Is it hard to hold? Does it cause a lot of pain? If it does, that's another obvious sign that you're having cervical weakness. When it comes to the actual symptoms of BPPV, it's often described as severe brief spinning sensation. You feel like the room is intensely spinning for about 20 to 30 seconds and then it subsides. When it comes to cervical dizziness, your symptoms could kick on and it doesn't go away in 30 seconds. It could last for minutes, hours, days, weeks, months. Sometimes it just doesn't go away at all. It could be triggered with moving your neck in awkward positions. This is where it gets tricky between BPPV and cervical dizziness. There's some common ground there. You could move your neck a certain way and theoretically trigger BPPV, but you could also trigger cervical dizziness. That's why I think the two get confused all the time. Oftentimes, looking up could cause dizziness, and that is a frequent thing that we'll see in cervical dizziness. So the symptoms are brief for the BPPV, not so brief for the other, and the sensation is different. Instead of the severe spin, you just kind of feel off balanced. You feel like this disequilibrium where maybe the room is just kind of waving and moving a little bit. That could another differentiating factor for cervical dizziness. If you have cervical dizziness, it may also accompany other frequent upper cervical problems like headaches. BPPV should not kick off headaches. Cervical dizziness will certainly kick off headaches for the right person at the right time. If you're getting frequent headaches, you notice that if you move your neck in awkward postures, that causes the headaches. That's a classic sign of upper cervical disorder. And finally, I'll mention if you have hearing loss and it started around the same time that you're getting vertigo and dizziness, that's a sign that it's something else besides the neck. But if you don't have obvious hearing loss, it didn't start at the same time that you have your dizziness or vertigo, you don't have an acute ear infection, and maybe you've had multiple Epley maneuvers, and not only is it not going away, but sometimes it could even make it worse, that's a sign that you may not have BPPV, but you may have cervical dizziness. Well, that's the video, guys. I hope you enjoyed it. I hope you got something out of it. Do me a favor, if you got anything out of today's video, hit that like button, and don't forget to subscribe to our channel so you never miss a future video on cervicogenic dizziness or cervicogenic headaches. Remember, my book is going to be out next week, Cervicogenic Dizziness Relief, a complete guide to a dizzy-free life. I'll put a link in the description. Check it out. It could be a big help to someone out there. Well, thanks for watching, guys, and we'll see you next time on Physio Tips Tomorrow.